Hi, my name is Nguyen and I'm going to be performing an IV piggyback today. So what I have running right now is 100 milliliters of normal saline into my patient. And what I'm going to be hanging is 2 grams of cefazolin in 100 milliliters of fluid. What I'm going to do before I even hang anything is check for the compatibility of cefazolin to normal saline inside the med room, and that I already did, so that's compatible. Before I hook it up to my patient, I'm going to make sure that this is the correct patient, the correct medication, the correct reason for the medication, and the correct time that the patient's receiving the medication, and how many doses before the patient's received. Okay, so before I start with my piggyback, I'm going to lower this normal saline. Since it's my primary, and then I'm going to pause this chamber. Now I'm going to get my cefazolin and pierce it through, remembering that sterile technique is needed the whole time while I pull this side off and pull the cap of the needle off and pierce it through the bag. Okay. Now I'm going to place it up here above my primary. And I have my alcohol pad. I'm going to scrub the hub above the chamber that's running for 15 seconds. Okay, and then connect this into that hub. Now I'm going to back prime my piggyback by opening up the chamber and holding it lower than the piggyback. All right, that looks good. And before I program it, I'm just going to check my patient, make sure the IV site is not infiltrated and there's no signs and symptoms of phlebitis such as pain, redness, warmth, and make sure the patient's okay. I could also flush the port near the patient to make sure the IV site is still patent before I begin running my cefazolin. So now that I have it connected and it's back primed, what I'm going to do is channel select, and then click secondary. I'm going to go to A through E, silence it, and then click C, click cefazolin, and then I'm going to run 2 grams in 100 milliliters. 2 grams in 100 milliliters, that's correct, so click yes. 2 grams in 100 milliliters, that's correct, so click next. And then 200 milliliters per hour, that's the rate that's being infused. And then volume to be infused is 100, and it's going to take 30 minutes, so that's correct, and I'll click start. And then before I do anything else, I'm going to make sure that I see the first drop. Perfect. And that's how you hang an IV piggyback.